Vaginal rejuvenation can encompass either surgical or non-surgical options. Surgery of the area can include labiaplasty, which can involve either the labia minora, which is most common, sometimes the labia majora, the mons pubis, and often the clitoral hood. Some non-surgical options involve either radiofrequency or laser tightening of the internal vaginal mucosa. Labiaplasty is a surgical procedure which trims excess labia minora tissue. Sometimes it also addresses the labia majora, and it usually also trims excess clitoral hood skin. Reasons why women might seek a labiaplasty are both functional and cosmetic. Some physical complaints include excess tissue that can be redundant in their underwear. Sometimes there's discomfort during intercourse or exercise like running or riding a bike. And sometimes it's purely aesthetic, meaning when they look down, they don't like to see extra folds of tissue down there. They think it doesn't look as pretty possibly as it could. And really, they just want to feel more comfortable in their own skin. And for most women, it's probably a combination of those reasons. A labiaplasty traditionally addresses redundant excess labia minora tissue. And it's usually the tissue that hangs a little bit longer and lower. It's more darkly pigmented, and it has an irregular cobblestone-y type of texture. And that's the extra tissue that when women look down, they see it hanging out. Sometimes it also trims the labia majora, which are the outer lips. And what women complain about is that they feel they're either too poofy, or especially with age and after childbearing, they can feel that it's somewhat empty. The labiaplasty procedure is going to be tailored to each woman individually, depending on her anatomy and what her particular goals are. So labiaplasty procedure, the type that's more common is called the trim technique, where excess labia minora tissue is essentially trimmed from the back all the way to the front. Sometimes additional folds of clitoral hood skin are also trimmed, and this is called a clitoral hood reduction. Another technique which is performed is called the wedge technique, and this involves removing a triangular piece of labia minora tissue from the inside and bringing things together. Surgery can be done either under local anesthesia in the office or under general anesthesia in the operating room. Either way, local anesthesia is always injected so that the tissue is numb, either when the patient wakes up or during the procedure. Risks of the procedure, like any surgery, include a small risk of bleeding, small risk of infection. There's going to always be some swelling and possibly bruising that generally resolves after about a week. The recovery is around a week, and I usually recommend at least a week off of work, definitely 2 to 3 weeks off of aggressive exercise, and up to a month off having sexual intercourse. Generally, by 3 to 6 weeks, the results can be seen. By 3 months, most of the surgical swelling should be gone, and that's when we can really appreciate the final result.